If you suddenly develop excessive thirst, frequent urination especially during sleep, lose more than just a few pounds, develop areas of darkened skin, or notice that even small cuts don't heal as quickly as they did before, suffer from fatigue, or become irritable, you may be experiencing type 2 diabetes symptoms which need to be diagnosed so that with the proper diabetic diet and further type 2 diabetes treatment, you may be able to remain non-insulin dependent. Eyesight may be affected, leading us to have an eye exam, but in combination with the other symptoms, it is extremely important to be evaluated by a physician. Without a proper medical evaluation and treatment plan, not only is the type 2 diabetes a problem, but episodes of low blood sugar can also become an additional serious medical problem. The actual cause of type 2 diabetes has not been determined, but it is thought that there are certain factors that increase the risk of developing this disease. Those who are obese, leading a sedentary lifestyle, have a family history of type 2 diabetes, who have developed gestational diabetes during pregnancy, and those of African American, American Indian, Asian and Hispanic descent are considered to be at high risk for developing this disease. Type 2 diabetes is not limited to a specific age group, but those who are over the age of 45 seem to be the primary target of this disease. Recognizing the type 2 diabetic symptoms early enough, this disease can be controlled without the use of insulin. Proper diet and exercise are extremely important in the treatment of type 2 diabetes so that the body is given the tools it needs to produce enough insulin, or to properly metabolize the sugar in our body that we need for energy, rather than having all that glycogen end up in our bloodstream resulting in abnormally high blood sugar. Even though most of us cringe of diet, the diabetic diet is crucial, and in reality, is not much more than learning to eat properly with some minor modifications. There is no known cure for type 2 diabetes, but the medical community is seeing type 2 diabetes, normally found in adults, to be increasingly diagnosed in children as well, possibly due to the problem of obesity in this country. There isn't any definite prevention of type 2 diabetes, but with a healthy diet, sufficient exercise, along with monitoring weight in order to prevent obesity or to lose the extra pounds not only decreases the risks, but also aids in the worsening of this form of diabetes. Type 2 diabetes symptoms are not to be ignored, because of the fact that type 2 diabetes, with its complications, can result in a critical situation. Learn more at type-2-diabetes-symptoms.com.